All right, this five-slide fix is on the transposition of the great vessels. Let's get on into it. This one is a pretty critical cyanotic congenital heart defect. In TGA, the aorta rises from the right ventricle and the pulmonary artery is going to rise from the left ventricle. When this happens, it's going to create two different parallel circuits, which means that the systemic venous blood goes from the right atrium, the right ventricle, to the aorta to the body, stays deoxygenated because it's not going through the lungs, and then the pulmonary blood is going to go from the left atrium to the left ventricle to that left pulmonary artery to the lungs where it constantly stays oxygenated. There is no mixing here, so it is not compatible with life. This is another one where survival is based on whether or not they have PFO, a VSD, or a PDA, because it's allowing the oxygenated and the deoxygenated blood to mix. Without that, we're going to see profound cyanosis at birth. Now, they can have profound cyanosis at birth, but it could be less severe because they have an open PDA, like if they're preemie. But when the PDA closes, it can be a lot more noticeable. So clinically, these infants, where I talked about it, are going to present with cyanosis at birth. You'll also see the tachypnea without significant retractions. This one is important, and it's a classic sign of the fact that there is no mixing of blood. Heart sounds, you're going to hear a single S2 and a murmur, but the murmurs are more dependent on the defects like a VSD or a PDA. You'll also see poor feeding, lethargy, and rapid desaturation if that mixing is inadequate. And if that PDA closes, you'll see shock will develop extremely quickly. Now, treatment begins with prostaglandins to maintain the patency of that PDA, as well as the mixing of the blood. To improve the mixing, we're going to see a balloon atrial septostomy, and you can also see definitive repair. The balloon procedure is kind of temporary until we can do that definitive repair, which is called an arterial switch. And the great arteries are switched back to their normal orientation. The coronary arteries are then reimplanted. Now, post-op, we're monitoring for coronary insufficiency, arrhythmias, and ventricular dysfunction. Nursing care, it's focusing on perfusion and oxygenation. So, with the interventions, we should hope that cyanosis should improve. We're going to assess for feeding tolerance, respiratory effort, and perfusion. We're going to watch closely for sudden deterioration if that PDA begins to close. Pre-cath is all the same. NPO, baseline pulses, informed consent from parents, and checking allergies. The post-surgery, you're keeping the leg straight if they've had any sort of catheterization. You're monitoring for bleeding, checking distal pulses, perfusion, watching for arrhythmias, or in this case, a coronary compromise, and then we're clustering care. Parent teaching, very simple, very, very simple, because again, they just had a baby, like the mom has just had a baby, and even dad too. They're a little overwhelmed. Emotions are running high, and then they just found out if this doesn't get fixed, they could potentially lose their baby. So you are going to explain to them in very basic terms. The great vessels are switched, so the oxygenated and deoxygenated blood are not the deoxygenated blood is not becoming oxygenated. Could be an easier way of saying it as well, or that they're running in parallel to each other. Surgery can help reconnect them the way that they're supposed to be. We're teaching the parents to watch for worsening cyanosis, poor feeding, and increased work of breathing. And we have to make sure that we let them know that this is not a one-time thing, right? We have to continue to follow up with cardiology, especially because of that arterial switch. And then after repair, we're avoiding strenuous activity and we're watching for fever, chest pain, and palpitations. All right, that's the resources, and that's it for this one. All right, I will see you in the next one. Thanks, guys. Bye.